Good morning and welcome. Today we're going to have a guest speaker, a lovely lady called Ms. Melanie Moore. And so welcome to all of the participants who've joined us. I'd just like to make an acknowledgement to country. The Leukaemia Foundation acknowledges the traditional owners of country throughout Australia and recognises their continuing connection to the land, sea and community. We pay our respects to their elders past, present and emerging. So why are we holding this seminar this morning? We understand there are many unique and complex aspects of the allogeneic transplant experience, one that only those who've experienced it can truly understand. This webinar is the third of a four-part series, and each with a different focus of allogeneic transplant. Today, we will be hearing from a person living with blood cancer who also happens to be an expert in the field. She will be covering her personal story of Allograft and her focus on health and well-being throughout her experience. Her professional story, the importance of looking after your broader health and well-being in managing the ups and downs of Allograft, with a particular focus on exercise and as an essential management strategy throughout the whole Allograft experience. And then the last 30 minutes will be an opportunity for discussion amongst the group. We often hear that those going through the allo transplant want to connect with others who are also going through this experience. Hence, we want to provide this opportunity for participants. We will draw out themes from the information presented and share our experiences and learn from one another. This will be facilitated by myself and the other Leukaemia Foundation staff. And you can choose to leave at the end of this session with our speaker if you don't wish to stay for the facilitation part. Okay. So this morning, Ms. Melanie Moore is going to speak to us. So since graduating from the University of Wollongong in 2009, Melanie Moore has worked as an exercise physiologist, inspiring and developing empowerment in individuals of various ages and abilities to achieve optimal health and function through exercise. Currently, Melanie is the Principal Exercise Physiologist and Clinical Supervisor at the University of Canberra Centre Cancer Wellness Clinic and is currently completing a PhD in exercise oncology with a special interest in haematological cancers. Exercise is an integral part of supportive cancer care and cancer recovery. Melanie has and continues to witness the importance of exercise for her clients and her firsthand throughout her own cancer journey. Welcome, Melanie.
Thank you for inviting me to be a part of the webinar this morning. I'm extremely passionate about what I do, and I really hope that everyone who's online at the moment will find it helpful, as well as encouraging to know that there is exercise as a means of therapy that can really help with throughout the continuum of care, whether it be before treatment, during treatment, and even beyond treatment into the recovery phase. So I'd like to start with initially with giving you a bit of an overview of my experience going through an allogeneic bone marrow transplant. So in 2015, I was diagnosed with malignancy, which required an urgent transplant. And in November of that year, I received my cells, which was from a matched unrelated donor from Poland, as unfortunately no one in my family was a match. And we call that day when I received my cells, which most people will call their rebirth day, is actually my butterfly day. So I went from an O positive to a B negative blood type. And it took about 9 months for actually my red blood cells to come to engraft. So I did receive blood transfusions almost every week to fortnightly until they came in. That my blood counts usually sat around the mid 7s to low 7s throughout that time. And I definitely knew when it was time to have a transfusion because I would find that I would start to come quite breathless. And then when they did my blood counts, then it was, in the low 7s to the high 6s. So during transplant, it was a bit of a roller coaster ride. There was ups and there was downs. And I found the best way for me to manage that was looking at what I could do for myself to support myself getting through that. And that's where I used exercise, eating well, and also mindfulness strategies to ensure that I could do what I could do to control a situation, whereas a lot of things happening around me out of my control. The going to appointments and having treatment was actually not new to me, because when I was 7 to the age of 14, I actually had very severe aplastic anemia. And so I required treatment, and I required blood transfusion, platelets, but I was in remission for about 16 years. And it was a complete shock when this new malignancy occurred, because I didn't know it could happen. And two, because when you're an adult, you're more aware of the risks and the complications associated with going through treatment. But because of my experience as a child, it actually made me realize that I wanted to help people. And as a child, I was always told you shouldn't exercise. It's really bad. Like, you could hurt yourself. We don't want you to hurt yourself. But I loved to exercise when I was a child. And so that's why I've dedicated my career to help people. And that's why when I went through my current treatment is there wasn't much research out there about what a person with an allogeneic bone marrow transplant should do. And therefore that's why I'm doing my PhD in this area, is because there's a gap that needs to be filled. And why not? So what we'll go through now is exactly what is well-being. So we want to stay as well as possible throughout this journey. And it's a combination of feeling good and functioning effectively. It's not necessarily about feeling good all the time, but it is about making sure that we have the strategies to thrive, to develop and thrive. And so it's ensuring that the psychological and physical burden that is experienced can be managed for long-term well-being. And so we know when we go through treatment that there are very common side effects, and the severity can vary based on each person. But these are the main side effects that people do experience. And so what we know is what we want to do is implement an intervention that will help to support and promote well-being before, during, and after treatment. So what we do know based on current research is that exercise can have so many benefits when it comes to improving our health and our well-being. And we also know that when we're going through the treatment itself, it can help prevent significant levels of fatigue and deconditioning as well. Now, there are so many benefits of exercise, and unfortunately I couldn't fit it all on one slide, but these are the main benefits that you will see and experience. So a lot of people do experience fatigue, and that can be one of the most debilitating sections or experiences because of treatment. And it's about 80 to 90% of people will experience fatigue. And what generally will happen is when someone's fatigued, their level of physical activity will tend to decrease because they want to conserve their energy. But what we know when it comes to cancer-related fatigue is that rest doesn't necessarily provide us with more energy. So people will adopt a sedentary behavior, which then can cause more physical deconditioning, which will then go into muscle wastage, and then that will go back through to greater levels of fatigue and around and round in this what we call the vicious cycle of fatigue. And so what we know is when we look at the research around exercise is that aerobic exercise and purposeful exercise is one of the most effective ways to help reduce the severity of fatigue. When we see clients in the clinic, and what I also noticed when I was doing exercise is, for instance, if you look at the scale, people can come in when we ask them out of 10, how severe is your fatigue? And if people give us, say, for instance, a rating of 6, after they do their exercises, it can come down quite a lot, and it can come down to, say, that 2 to 3. Depends on where the person initially starts on that scale. If they start a little bit lower, sometimes they'll actually leave with no residual levels of fatigue. So it really depends on where the person is and when they first come in, and also what sort of exercise is being done. But what we know, even though aerobic exercise is more superior to any other forms of exercise when it comes to managing fatigue, if, for instance, someone really enjoys doing resistance exercise, we know that's still going to be effective at reducing fatigue, but it won't be as efficient as reducing fatigue if you do, say, aerobic exercise. So we know that implementing exercise as a preventative for fatigue is effective. Also, during and after treatment, it can be effective at reducing fatigue levels. We also know that exercise, if it's supervised or unsupervised, it's equally as effective. And the same with if an exercise intervention is implemented in a group environment, or if it's done as a one-on-one, we still know that it's effective at reducing fatigue. And when it comes to how much exercise someone should do to see those benefits of a reduction in fatigue, they're seeing that you don't have to achieve the 150 minutes each week, which is what's currently recommended for health benefits. We know that less than that can still be effective at reducing fatigue levels. And especially when you're in hospital and you're going through that transplant process, sometimes achieving that 150 minutes a week is not necessarily achievable, but it's helpful to know that you still can experience a benefit with less than 150 minutes. So if we could capture everything exercise does in a pill, it would be the most popular pill ever, because of the amount of benefits that it can have. So we do call exercise as a form of medicine. It does depend, though, on the type of exercise, the intensity that you do, how frequent you do it, and how long you do your exercise. So what's currently recommended for people, we'll go through what's exactly recommended for all cancer patients, but then what I will do is go more down into, break it down a little bit more into before, during, and after transplant, specifically for allogeneic transplant participant recipients. So aerobic exercise, so what exactly is it? So it's purposeful movement of the whole body. So it increases your heart rate, and it also increases your breathing rate. It can be done on equipment such as a bike or a treadmill, but it doesn't have to be. It can be done in the safety and comfort of your own home. If you've got 2 square meters space in your home, you can definitely do some exercises in that space, such as walking on the spot, or some other forms of movement. You can also dance if that's what you like to do. We also know that when you're in hospital, if you're able to go for a walk up and down the corridor, that is also aerobic exercise. And for me, when I went through my transplant, I did do I did walking as much as I could. And I would take my drip and I would go for a walk. It was much slower than what I would normally walk at, but that's as fast as I could walk at that particular time. And I actually became what they called me as the walking girl, which I thought was quite funny, because I didn't know that until I shared a room with another patient, and she's like, "Oh, you're the walking girl," and I was like, "Yes, I guess that's me." And so she actually said, because she didn't think that she was allowed to go for a walk, she decided to go for a walk as well. And even though I wasn't allowed to actually tell people what they should do in hospital, but someone seeing what they could do, it actually inspired that particular person to go for a walk. So what's recommended? So at the moment, for all cancer patients, it's recommended that you achieve 150 minutes of aerobic exercise each week. Now, this can be accumulated throughout the day, which can be 10 minutes in the morning, 10 minutes on lunch, or 10 and 10 in the afternoon. But if that's too much, then you can start with just 10 minutes and gradually progress towards that overall goal of 150 minutes. And please don't do 150 minutes all in one go. You want to make sure that you do have it throughout the week, which can equal to 30 minutes 5 times a week. You can also do, depending on where you are within that transplant continuum, is you can also aim towards more that vigorous form of exercise as well. But you want to always gradually progress to increasing your intensity when it comes to exercise and making sure that you're safe when doing it. Now, as you can see with each section where it says low, moderate, and high, I've also given you numbers, which is RPE. And RPE is a scale we use of how hard you feel you're exercising. And on the next slide, I'll show you exactly what that is. But I've also given you your heart rate ranges for each of those areas as well, which is really important, especially if you have, say, a smart device. It's important to know where your heart rate should be. So for instance, if I want to work at a moderate intensity, it's 220 minus my age, and then I times the percent, and then I times it by the percent. So 220 minus my age times 0.7, and that's the intensity that I want to be working at if I want to do a moderate intensity. And that's where we know the reason why there's this evidence is that that's where all the health benefits are from. So when we look at how to monitor your exercise intensity, this is the RPE scale on the left-hand side. So we ask, out of 10, how hard do you feel you're exercising? And so as you can see, if we want you to work at that moderate intensity, it's between that 3 to 4, which is moderate to sort of hard. Now, if you don't have access to this scale, you can also use the Sing Talk test. So if you're able to sing when you're exercising, if you're going for a walk and you can sing, it's probably saying that you're working more at that lower intensity side of things. If you're able to talk, so if you're able to talk in sentences, then you're more than likely you're working within that moderate phase. But if you're unable to actually answer people in more than one word sentences, then you'll find that that's where you're probably working in more that vigorous side of things, and you might need to adjust it based on that. So that's a really useful tool to determine how hard you're actually exercising. And you want to make sure that your intensity is always symptom guided. So for instance, if you go for a walk one day and you're able to walk the block, and you can rate the intensity might be about a 3, and then another day, if you've had to have subsequent treatment, and you find that walking that block and it's actually quite really hard, then you might want to turn it down just a little bit, so not go as far or not as fast, just to make sure that you're still working within a safe range. So resistance exercise is also recommended for patients diagnosed with cancer, and resistance exercise is your muscles working against a force, so to create a contraction. And so you don't need fancy equipment to do these exercises. You can use your own body weight. You can use cans or anything around the house that you've got access to. And if you have TheraBands are excellent to use because you can pop them in your bag and they can go anywhere and they don't actually weigh anything. There's a lot of exercises you can do with TheraBands. You can also use weights if you have access to weights. But if you find that, sitting or standing on particular days is quite challenging, you can also do exercises on your back, which I think is excellent, especially when you're going through the actual transplant journey in hospital. You can do some exercises when laying on your back, so you keep moving. So what is recommended? So at the moment, they're advising that you want to use all your major muscle groups when it comes to doing resistance exercise. And you want to make sure that it's progressive in nature, because if you do an exercise, say for 6 weeks, and you're doing it on a regular basis, doing the same thing without changing your weights, you're going to find that you tend to plateau. So if you want to continue to experience benefits, it does need to be progressive in nature. And that's where we go back to that 10% rule with any form of exercise is a little bit more challenging every time. So you want to do 2 to 3 times a week of resistance-based exercise. And it's recommended that you do it at a moderate to a vigorous form of exercise. So that's going back to the RPE scale. And you want to do 2 to 3 sets of 8 to 12 repetitions. Now, what that means, if you're not familiar with what reps and sets are, a repetition is if you bring for instance, a bicep curl. So if you actually have your arm down by the side, and then you bring your fingertips all the way to your shoulder and then all the way back down, that's considered as 1 repetition. So if you do 8 or 12 of those, that's considered 1 set. You always have a rest for 30 to 60 seconds to allow the muscles to be ready to do the next set. And you want to make sure that you do have rest between your exercise days to prevent overuse or potential injury, and allow the muscle also to get stronger so that you can see benefits. Sorry, I'm just going to have some drink. Okay, so the other component to fitness that we would like people to also look at is what we call neuromotor exercises. And that's what we do when we look at challenging your balance, your coordination. It might be including some walking, and that's what gait is. And it might be also looking at agility. So being able to respond to different directions safely. And that's what's really important, is your safety is first. So the pictures that you will see when you're starting out to do neuromotor exercises, you don't have to do those. They're the only photos I could find though. But you can do things like standing on 1 foot. If that's too hard, then you can stand as if you're standing on a tightrope. So bringing 1 foot in front of the other, and it challenges your balance and your coordination. Now, some people throughout the transplant process, or even because of the treatment that they've had before going through a transplant, can cause what we know as peripheral neuropathy, and that's in your fingers and toes, and it feels like pins and needles. And so what we are seeing, and we use this quite frequently at the clinic, is it's called sensory motor training, which is using things like spiky balls on those fingers and toes, and it does help to reduce the severity of the peripheral neuropathy. So it's not very common through an allogeneic bone marrow transplant, but there is some people out there that do experience that. But just know that the severity can be decreased. Now, you can do these exercises 2 to 3 times per week, but there's not any sort of set guideline of how frequently you should do this, and you can actually do it every day if you'd like to. There's nothing out there that says that it's going to be harmful in any way, but just make sure you have hand support when you do your exercises. The other component is stretching. So stretching is great with restoring your range of motion. It's also great with improving your posture. And it's also really good with reducing your stress, muscle tension, and also muscle pain. And so when it comes to stretching, you can do stretching every day as well to have a more superior benefit, but you can also do it that 2 to 3 times per week. And when you're doing a stretching, what's important is not to actually go to the point of pain. It should be feeling slight tension, but never pain or discomfort. And if you do, then definitely ease out of it. Some people will tend to bounce in and out of a stretch. What we encourage though is actually being more of it's called a static stretch, is when you're actually holding that stretch. And that can be between that 10 to 60 seconds. So obviously the longer that you hold the stretch, you'll find that that's where you head more towards that flexibility, because the muscle tends to lengthen just that little bit more. So being aware of what the goal is for the stretching is really important, and then you're being aware of if it should be a shorter period of time or longer will really depend on what you'd like to achieve. Now, when we look at exercise, we want to make sure it's enjoyable, because let's face it, if it's not enjoyable, we generally don't do it. So for me, what I found was I actually danced, or I moved a bit in my room. I loved taking my dog for a walk when I was able to do that. And I also really loved doing weights as well, because I knew that doing weights was really important when it came to maintaining my muscle strength and my muscle mass. So finding things that you enjoy is really important. So what we'll talk now is the actual process. So before, during, and after treatment, what should someone do? Please be aware that the information I am going to be speaking to you about is preliminary evidence. It's not necessarily translated into clinical practice yet. Some places have implemented it into clinic, but some haven't. And that's where I'm really hoping that with the research that I do as well, we can really make an impact in these areas. So before transplant, what we consider this is prehabilitation. And so there has been some studies, but this one in particular was quite effective. So what they saw was if they implemented exercise 4 to 6 weeks prior to transplant, and I understand that sometimes that's not possible, but if there is that time between when you get diagnosed and the transplant, what they see is if they can exercise 2 days a week with combining both aerobic and resistance-based exercise, you can see on that top line that their level of deconditioning was a lot less than someone who didn't actually do any exercise. And then if you look after the transplant, then you can see that their fitness and their quality of life, as well as their fatigue levels, did not drop so much. So they maintained a level of physical functioning. So just be aware, though, this is it is one of the best studies that I have found, but there's not that many out there. But that's the importance of rehabilitation, is about making sure that that drop during treatment is not so significant. So then if we go through looking at the during hospitalization, so if you look on the actual figure, you'll see that during transplant, everyone experiences a decrease. So everyone experiences a decrease in their physical functioning. They'll experience fatigue. But the difference between someone who's doing some exercise and not doing exercise is quite different. But what we know is doing something is better than nothing at all, because you'll find that staying sedentary, that's where you'll notice that muscles will tend to weaken, and they can also decrease in size as well. So we really want to focus more on just doing something, and it might be going for a little bit of a walk or doing some movements in bed when you're feeling well enough to do so. So exercise definitely has that potential to decrease the level of deconditioning. The other thing that is also important to note is breathing exercises during transplant as well. And that's strengthening your muscles when you breathe in and strengthening the muscles when you breathe out. And what they found is that it can help reduce the risk of long complications or infections in hospital. So I thought that was quite important to note as well. Now, when we move past transplant, so when you actually get discharged, that's what we consider as post-transplant. And after, and that's when you start the recovery process. And the recovery process can take time, but it doesn't happen overnight, but it definitely does happen. And it all the major physical limitations, what they've found is that it can reduce over that first year. But because a lot of people are on high dose prednisone, and it could be just because of post-transplant or also because of graft versus host disease, there is an increase in lower leg strength loss. And so they know, what we're seeing is that when it comes to exercise, it can help reduce the severity of the reduction in lower leg strength. and improve that. So then your ability to maintain the activities of your daily living can definitely be improved. When we're also looking further along the continuum as well, when it comes to exercise, what we want to also achieve is preventing the onset of other comorbidities. And unfortunately, allogeneic bone marrow recipients are at a higher risk of cardiovascular disease, diabetes, and osteoporosis. And so what we know is that exercise is a really important integrated part of reducing that risk. So it also helps you to get back to, say, if you're working and want to get back to work, and also if you're wanting to returning back to sport, because going through the allogeneic transplant, it can range from, you know, teenagers, kids, all the way up to the elderly as well. So knowing exactly what the goal is, what you'd like to get back to, is really important, because that can also determine on what exercise intervention will be implemented. So then we look, this is just a bit of a summary of the research that is out there at the moment. So making sure well-being across the continuum of the transplant journey. So before, during, and after treatment, and just be aware that more research is definitely needed in this space to enhance patient outcomes. So there are safety considerations that need to be implemented when it comes to commencing an exercise intervention. You definitely want to make sure that you have that conversation with your treating team or your hematologist, asking them if you're cleared to exercise, and if they are aware of someone that you can be referred to as well, is really important. You want to make sure that you are well, so you don't want to have a cold or a flu when you're exercising. You also want to make sure that you've got the adequate space, adequate clothing and footwear as well is really important. And you want to make sure that you also remain hydrated when you are exercising. And if you are prescribed any form of medication, that you make sure that you take it at the appropriate times. And if you do have asthma, or if you have anything like a Ventolin, or if you have a nitrate spray, or even if you have anti-nausea medication, make sure you have that with you at all times, because what we find is when people, they might wake up, they might feel great, and then by the time they come to the clinic, then they're like, oh, I'm starting to feel nauseous. And we say, you know, did you bring your anti-nausea medication? They're like, oh, no, I didn't think I needed it. And then they're like, I don't think I could do anything today. Or maybe they're like, I'll do a little bit and see how I feel. So make sure you always carry it on you, because sometimes it can hit you unexpectedly. So there are safety precautions as well. So you need to make sure that you don't exercise if you do have a cold or a flu. Bone pain, that's predominantly for people that have, if they've been diagnosed with multiple myeloma and they've got lyric lesions. If you're experiencing bone pain, then it's probably a good idea to have a conversation with your doctor first to see if exercise is safe during that period of time. You also want to make sure that you don't experience any lightheadedness or dizziness when you're exercising, because there's the risk of falls. And you also want to be aware of what your blood counts are. Now, this is predominantly more for going through the transplant. Sometimes after, that's when blood counts may be obviously coming up. I found, obviously, as I was saying, after transplant for 9 months, my hemoglobin was quite low. And this is what the current evidence was saying, was I shouldn't have been exercising if it was below 8. But if I waited for my bloods to come in, then I would have waited 8 months and I could have been a lot more deconditioned. But because I am an experienced clinician, I was able to adjust what I was doing. But this is something that we're going to be working on, is whether or not exercising at a lower hemoglobin level is going to be safe for people. So hopefully in the coming years, you'll actually start to see that that's something that might change. So how do you stay motivated, or how do you get the motivation to exercise? Now, to be honest, when it comes to motivation, you know, sometimes we'll say, oh, I'll do it tomorrow, or I'll do it next week. Sometimes motivation doesn't find us. And so what's really important is we have a strategy to actually start moving. And this is what we call the 5-second rule. So if you have a plan, you know what you're meant to be doing when it comes to exercise, you count backwards, you say 5, 4, 3, 2, 1, you get up and you do what you're meant to do. So if you know at, say, 10 o'clock, I'm meant to go for a walk, you count backwards and it gives you the motivation. Well, I find it does, and we find that it's quite effective at getting people to start doing their exercises. Having a program is also really helpful. So that's where it's important that you find a clinician, you know, see an exercise physiologist or see a physiotherapist that are experienced in exercise oncology. And if you can have access to someone who's had experience with hematologic cancer patients, even better. But having a plan is excellent. If you've got a Fitbit or a smart device, that's also really great. You don't need one, but if you do, even better, because you can monitor your heart rate. You can also monitor your steps. And also what I found really helpful was keeping track in my phone. So every single day from day 0, which was transplant day, butterfly day, all the way up to my 365 days, I counted every single day. And I also keep track of what I did on those days as well. So I put it in my phone. So if you've got a phone, you've got a calendar, it's definitely helpful to keep track of what you're doing. And then you can also look back of how far you've come. What we do in the clinic, though, we also give clients one of these sheets, which helps us to assess what they're doing each day and what sort of strategies we might need to implement if they're finding certain areas quite challenging. But it gives you an idea of, you know, especially when it comes to your fatigue, pre and post exercise, how much of a positive impact that's had. And what you've been doing, so we can see over a period of time, you know, it might be slowly increasing the duration of your walking. It could be gradually increasing the exercises when it comes to resistance exercises. Even if there's days when you couldn't exercise, it might be like, okay, well, what happened on that particular day? Do we need to think about particular strategies to improve it? So we know that exercise is a really effective modality of improving physical function. We also know that if we combined it with nutrition, that it has a more superior impact of reducing that physical burden as opposed to one single discipline. And we also know that if there's a psychological component to that as well, that it helps to increase the adherence and supports the integration of exercise and nutrition. And so this is one of the projects that we're currently doing, is looking at all 3 of those disciplines of how we can help support people through when they've been diagnosed with a blood cancer. So making sure that you've got access or seeking help when you need to get the access to these services. So throughout the journey, we do know that there's ups and downs, and it's really important to recognize that you will have good days, you will have not so good days, and sometimes you will have horrible days. And so it's important to know what your physical limitations are during those times, and knowing it's important to pace yourself as well. So I know for myself, I always put it down to 3 days. If I was having a good day or not so good day, then I knew doing something was better than nothing at all. But on my absolute horrible days, which meant, you know, sometimes between me and the bedroom and the bathroom, those are the days that I actually had a rest day. So it's really important to recognize that you will have those days, but you can also, it will, you will get past that as well. So if you have any questions, you're welcome to contact me. You can contact me from my email, and if you would like to actually see if you'd like a telehealth appointment as well, we do offer those as well through the clinic. So yeah, please reach out if you'd like to. So I really hope that you found this presentation helpful. I really hope that it's also encouraged you to consider how you can integrate exercise into your day-to-day life to help improve well-being. Thank you.
I'd just like to encourage anyone, if they go to the chat bubble down the bottom of your screen, you can type in some questions. And whilst I'm waiting for those to appear, we've just had a couple of questions that have been given to us pre the seminar. And I'd just like to put these to you, Melanie. You know, I think one of the things that I quite often get asked is that exercise wasn't part of my lifestyle before I had a blood cancer. And I think people think of exercise only as going to a gym or something structured. So can you offer some suggestions how they can adapt exercise to their lifestyle, but also offering advice about what common things we might be doing in our daily lifestyle that could be considered exercise?
Yeah, absolutely. That's a great question. So when we look at exercise, so there's two forms. You've got physical activity, and then you also have exercise. And so exercise is when it's more structured. So you're planning on going, say, for a 10-minute walk. But you can also do more incidental physical activity, and that's what we encourage people to try and do a little bit more, which is, it might be parking a little bit further away between you and maybe the shop, or you and your next appointment at the hospital. So parking a little bit further away, so you're increasing your level of physical activity throughout the day. If someone's not used to exercise, if it wasn't part of their lifestyle before, but they're wanting to get into or start exercising, what we encourage is that they can start with small walks initially, but if they feel like they want a little bit more support, then that's where it's really important that they do reach out, speak to their doctor, and hopefully their doctor's able to recommend a particular exercise physiologist or physiotherapist so that they can give them a little bit more guidance and support. So it just reassures that what they're doing is appropriate for them.
Thanks, Melanie. I know that there's a lot of people that do a lot of things around their homes, such as vacuuming or mopping the floors or dusting, cooking, those everyday chores that we have to do. Would you consider that to be part of exercise?
Yeah, look, to be honest, when I was first discharged, I definitely did a lot more cleaning. And so I found that as part of exercise, that was physical activity. So yes, absolutely. It's something that will keep you moving, and you'll find that if it allows you to move, so you're moving, then that's definitely what we encourage someone to do. So you don't have to have equipment or anything like that within the home. You can also do gardening. Just make sure that your sun's smart, because we are at increased risk of skin cancers. So make sure you put your hat on and long sleeve shirts. But absolutely, just make sure that you keep moving. That's the most important thing.
Thanks, Melanie. I think you brought a lot of information that's very relevant to the group today about exercising, allowing individuals to develop and strive, and it does create a well-being and clearly reduces cancer fatigue. And in relation to that, one of the questions that has been put in the chat is whether someone was questioning, what do you mean you began your exercise from day one? to day 355. And I think that when you've been through a transplant, you understand those numbers of time of length of treatment. But could you just expand on that a little bit for those that perhaps might be embarking on their transplant phase? They're in the pre-stage.
Yeah, absolutely. So when you receive your, when you go into hospital in preparation for your transplant, that's what they generally call your minus 10 or minus 7 days up until your actual day that you receive your stem cells. So when you receive your stem cells, that's called day 0. And then every day after that you count, well, I counted. So you've got the first, after that, so you've got day 1, day 2, day 3, day 4, all the way up to 365 days, which is that year past treatment. And so following that, that's when instead of counting every day, I may have counted every month post-transplant, because those there's specific milestones that they want you to achieve. So first it might be your first 100 days, and then after that it might be, you know, your first year, and after that it might be every, you know, your 2-year mark, and then that's when your risk of relapse is quite small after that 2-year mark. So that's a way that I try to manage and get through each day. And that's where, when it came to exercise, I was counting the days, but I was also keeping track of what exercise I was doing on those days following my transplant.
Thanks, Melanie. I think that's answered the question nicely. I really loved your analogy of if exercise could be given as a pill. Because I think that there's a lack of motivation for a lot of people when it comes to exercise. And I think if they're already cancer fatigued, trying to actually even think about that motivation of doing exercise is, a setback for many people. I think different treatment centres have different theories, and in an ideal world, what would be your recommendation for someone that would be embarking on a transplant about their exercise regime when they've been told they're going to have an allogeneic transplant? What would you recommend as an exercise physiologist for them to try and achieve?
It depends on, let's talk ideal world. I would say if someone's been advised that they do require an allogeneic bone marrow transplant, that they have at least 6 weeks between when they've been told they need to and when their date of transplant is. So that will give them adequate time to implement an exercise program, get their muscles a bit stronger, get their heart a bit stronger, so their cardiovascular fitness a little bit up as well, in preparation for their transplant. So during that phase, that's where I would really encourage that there would be aerobic exercise and resistance exercise to help target that potential decrease in physical functioning, so reduce that deconditioning component of it. And that's one of my, I would say, my career goals would be, is to ensure that every place in Australia, every hospital will have this form of intervention in place for recipients, that they have a pre-transplant program. They'll do exercises during, and they'll also have a plan post as well. So that's my goal as a professional, to make sure, and also my personal, because I think we know that it definitely is helpful, and I really believe that really helped me get through my journey.
Thanks, Melanie. I think that brings us to another really pertinent question at the moment with COVID and the lockdowns, and for those who would be wanting to optimally try and achieve those goals. What would you recommend for those in lockdown, how to access these types of programs and get motivated or do an exercise program?
So thankfully, I think the one great thing about COVID is that it has really pushed more telehealth. And I think that allows people wherever they are, even if they're rural, to access services online. They can reach out to the professionals that have that experience and that knowledge to really support them. And so you don't need to leave your house at all to do your exercises. You can do them in your living room. If you've got access to a TV or a computer, you can do your exercises being supervised by someone remotely. And I think that's what is really great about the current situation, is that's really opened up that it's really pivoted a lot of services to realize that this is what they can offer and that they don't have to access them on site.
Melanie, one of the things that I'm quite often asked by patients is, they're feeling very fatigued and their mental health is quite low, they're anxious. And I quite often recommend starting off with walking, but doing it with someone. The other thing that some of our clinical psychologists have recommended is there's a difference between walking on a busy road to walking in a nice park under trees and things like that. What's your take on where one should walk and how it is best for your well-being and physical health?
I think it really depends on where you live. If you've got access to be able to walk outside, and if you feel like you can leave the house in the current situation, you can walk outside. It depends on where you live. Obviously, if you live in the city, then it's going to be quite tricky to find, trees and a lake. But if you have, it depends on where you live. If you can walk down with someone, obviously always walk with someone. I highly encourage that. But if you can walk down near the trees and hear the birds, and it allows you to sort of help you to open up your, helps to calm the mind a little bit and be present. And that's part of being mindful as well, is taking in every minute that you're out. But the most important thing when you are walking is making sure that where you're walking is safe. So making sure that you always carry your phone with you, or if you're with someone, and you're not putting yourself in uncompromising positions. So getting out and about is always great. And if you've got a dog, definitely, and you can walk your dog, then absolutely do that as well. It's great for you and it's also great for them.
Lovely, thank you. We've got a few questions coming through in the chat, and I think it's good to acknowledge that, even achieving a small amount of exercise in a day is actually a good thing. And I think that brings back to when you were talking about recognising your good days, your bad days, and the very difficult days. So I think to celebrate that you've achieved something is a good thing. So John, thank you for that. Obviously, Melanie, everyone's really enjoyed your presentation, and a lot of people would probably be thinking they wish they had this prior to embarking on an allogeneic transplant. But there was also a comment that they might have been less receptive at the time, and probably because of information overload, anxiety, or physical decline due to previous treatment. What do you think would be some strategies to be encouraging people to adopt an exercise program when they're feeling like this?
I think when it comes to, I think what's really important is that having that multidisciplinary support team is really important. So that's where you have, because when you diagnose, it is really overwhelming. Because a lot of the time why you go through a transplant is that you're trying to survive, and so that whole that thought is really overwhelming. And so a lot of the time, if you haven't been exercising before and then getting people to exercise, what we see in the research is that a lot of people don't want to be involved in the research because of that, that it's a big psychological burden, which is extremely understandable. But what I would highly encourage to help minimize that is making sure that there is that interdisciplinary support team. So, you know, having an exercise physiologist, having a psychologist, having dietitian, and making sure that that's a part of the process. So it really starts with the treatment team. So it really depends on making sure that there's not so much information overload, but I think it's re-establishing what information is provided. So I think when it comes to if someone is going to have a transplant, I think having access to the information is really helpful, and they can make that decision of what is best for them during that time.
Very wise words, Melanie, and I think that a lot of people have gained very valuable information from today's session. I think the comment that this has been gold just says it all. And I think for those that are in that stage of about to embark on their transplant, this has been exceptionally helpful for people like that. And I also think it gives them time to access those very three important things you were just talking about, not just an exercise program, but your mental health and a good nutrition. And I think it's also very useful for the carer, who perhaps is a key component in this whole journey for someone, because they're the ones that are supporting the patient through this. Can you just briefly give us a little bit of insight into how your carer impacted on your mental health, exercise and nutrition program during your transplant?
Absolutely. So during that process, my family was definitely my parents and my sister were very good support. I sort of told them what I would like to do. So especially when it came to in hospital, I said, you know, there may be days when I'm not feeling great. And so I said to them, you ask me, what day is it today? Is it a good day? Is it a not so good day? Or is it a horrible day? And I said, and I will always be honest, but you have to ask me if when you come visit me. And so then there would be a day when my sister would come in and she goes, Mel, have you gone for your walk today? I'm like, no. And so she's like, okay, what day is it? Is it a good day or a not so good day? I was like, not so good day. She's like, okay, come on. And I was like, okay. And so then I would just would do one lap of the ward first, and then she's like, how are you feeling? I'm like, yeah, no, I feel okay. And so I was able to keep going. So I think having that support person is really helpful, because and making sure you're honest with them is helpful as well. One thing that I've recognized is that making sure that you also care for the carers is so important. And so at the clinic, that's something that I have been, because I run the clinic, I'm very lucky to implement, is that we look after the carers as well. So if the patient comes or the client comes for their exercise, then so does their support person. If they want to, they don't have to sit and wait, because it's really important that everyone looks after themselves during that whole process as well. So I would say make sure that if carers are online, make sure you look after yourself as well. Make sure that if you go for a walk, make sure you still go for a walk, because you need to stay well and help support your person.
Very wise words, and we do understand the importance of caring for the carer, and I really appreciated you talking about being honest and setting boundaries. I think that allows for a smoother road, and people will know where they're at. And it's like having a plan. If you are prepared and have a plan, it does allow for people to understand what you might be experiencing and to know what your boundaries are during those times. Melanie, you know, you've been exceptionally helpful. You've given us great words of wisdom today. And I think I'll hand back to Linda at this point, who is going to talk about a pilot program we have at the Leukaemia Foundation involving exercise.
Thank you, Jane. So this I think fits in very well with everything that Melanie has spoken about in regards to, you know, how to get started, how to exercise safely, and how to uh, um, do what you need to do to help yourself. So at the Leukemia Foundation, we've started a pilot, which is to help you to learn why exercise is important, um, and to be able to access it. So we're calling it the Access to Exercise Pilot. Now, we know that it's difficult for you to get started. And we know that there are barriers sometimes to helping people get started, which can be anything from living regionally, I guess, to being fatigued, or even the cost of accessing an exercise physiologist or professional to help you. So we're hoping to be able to provide you with support and motivation and information to be able to do those things at the Leukemia Foundation. So if you're interested in this, and it doesn't matter where you're at in your transplant, if you're pre-transplant, during transplant, or post-transplant, please make contact with us. If you make contact with your local blood cancer support coordinator, you can do that by ringing the phone number on the screen, and then just ask them to be referred. Ask for them to refer you to the state lead, so for the Access to Exercise pilot, and we'll see what we can do to help you to do the sorts of things that Melanie has talked about today in her discussion.